So I believe Vinith already covered the introductions. As far as Pravaah Consulting is concerned, it's a digital agency and it's focused on digitally transforming healthcare facilities, primarily to drive more patients, engage with them in timely manner, and also digitize the operations for better efficiency and keep the costs low for healthcare facilities. A couple of things to note for the next hour or so. We have put everybody on mute, but that does not stop anyone from asking questions. As we continue with the presentation, I'll pause in between and ask people to really submit their questions. Vineet will be managing the questions, and if there is anything which we need to address, we'll address it. And we do have a Q&A session towards the end, which we'll also invite people to, just record the questions as and when they actually come across, and we will try to cover as many questions as possible today. Okay, and if anybody is not on mute, please go on mute, and we'll be continue to with the presentation. As mentioned earlier, the recorded session will be sent out via email to everybody who has registered. So this will be there. It will be probably also posted on YouTube, so you can also go back and listen in. Don't worry to take screenshots as I present, because the presentation will also be mailed out to you. Okay. So what we have is a pretty packed agenda. We'll start off with some industry stats, as you will see in the healthcare, current state of healthcare as to what really happens today. What are the challenges we are hearing from people? We'll talk about some of the tech trends, not really kind of get deeper into it because this can itself take about more than a couple of hours. We'll share our point of view as to what hospitals and clinics and doctors would be needing. And then there were three things we talked about in our webinar, as we were actually asking people to participate: how to really win trust of patients, how do we really build intelligent systems, and then last but not the least, how do you really optimize your operations to keep the costs low and be more efficient and serve the patients better. So we will share some thoughts around these three areas, and we'll just talk about how Pravaah Consulting can help in your journey as you try to embark this digital transformation journey. And then towards the end, we'll just have a Q&A session where we'll cover most of the questions which you post in the chat. So please feel free to go to the chat on Zoom and ask your questions as we proceed. And as and when needed, I'll answer those. Otherwise, we'll answer those towards the end. All right. Having said that, let's get started. Just to level set, what is digital transformation in healthcare? What does it really mean? And again, digital transformation means so many different things to different people. For somebody who's not really familiar with the tech space, it's almost like I want to use technology and that's going to be digital for me. And so, but how we define or how we look at digital transformation is the advancement in technology through which you are able to provide a seamless patient experience. And I would like to stress on the experience part quite a bit here, because that is what drives everything which you do as an operation in terms of the experience. And also these technological advancements, how they actually help you optimize your day-to-day operations, and which in turn should lead to a better healthcare service for the patient. So this is primarily how we stitch together digital transformation for healthcare. Now, again, digital transformation as a term is there for over a decade now. A lot of people have been talking about it. And I would just leave you with this thought that many industries have gone into digital transformation very early on. Tech industry, of course, led the way. They were all digital natives. They were born as digital companies. And it has always been said that the healthcare is the last frontier, right, from a digital transformation perspective. And that is what we are noticing, even from some of the stats which we are actually seeing that digital is here. It's already we're seeing a lot of adoption, and then from Indian market perspective, we are seeing tremendous growth in health tech. A lot of startups, a lot of entrants, a lot of funding going into the space. And by towards the end of this year, we are thinking it's about $5 billion is what the size of the health tech industry will be, which comes to about 40,000 crores. And again, it's growing at a tremendous rate. And with this rate, if it continues for the next 5 years or so, we are looking at about 150,000 crores in the next 5 years. So health tech is really growing big. A lot of companies are coming in the space. A lot of expenditures going on in the space. Digital healthcare market again is again the digital part of the healthcare market. That itself is also pretty big right now. It's 48,000 crores, almost more than 10% of the total healthcare market. Diagnostic market is another big market in the healthcare space. And what we have also noticed is the pandemic also kind of accelerated something called a telemedicine market, where people who wanted to really get consulted sitting at home and really getting help and support from doctors wherever they were. So that market is also kind of growing tremendously. And we see that growing in that pace quite a bit. A lot of small entrants in the market out there trying to have point solutions where they just go and say, hey, I will help you with the telemedicine setup, and a lot of facilities are also warming up to that idea. Now, despite healthcare industry being a late entrant, as because others were actually deep into digital transformation maybe 6, 7, 8 years ago, we see a lot of focus and a lot of speed as how this is growing. And again, it is important that as a smaller facility, smaller hospital owners or entrepreneurs who are actually trying to be in the digital in the healthcare space, you got to be really ready to really reap the benefits out of this. And if you're not really ready to really kind of adapt to this or work the way the industry is really headed, you are bound to lose out quite a bit in terms of losing out on the patient trust, even from a business standpoint. In our surveys and in our research, we have also noticed that how the cities are structured, like the bigger cities or the metros are a lot more aware of the fact that this is a technological investment in healthcare is very important, and they need to really think through it as they plan for the next 10, 20 years. The tier 2 and tier 3 cities are still not very convinced, although in bits and pieces we are seeing technological advancements, but most of the tier 2, tier 3 cities actually go by the brand value of a doctor or hospital, and most of the times it's a general perception that we already have a big name and we don't really need to do much about it. But things are changing, things are slowly changing, as you can see from the industry stats. In the current state of healthcare, I just wanted to share some other stats about from a patient standpoint, what is really going on and what have we really observed. We are like most of the patients, from a patient journey standpoint, most of patients are searching on Google, right? Looking for facilities, looking for treatment, and there's a lot of interaction going on Google these days. About 70% of the patients do consider online reputation before deciding the healthcare facility. 71% of the patients lose trust if they find a facility and they are not finding relevant information, which they were actually looking for, which triggered them to really click on the website. And as we see, like almost half of all the patients do demand digital interaction, whether it's booking an appointment to really filling out forms, or maintaining health record, having health record at their like, on their fingertips, also paying bills. So people are walking away from the traditional way of really interacting with healthcare facilities, and they're expecting more digital interaction. And from a new generation standpoint, what we are also noticing is more and more people are open to discussing health issues and what's really going on social media. So there's a social media is not something just for entertainment. People are talking about issues. People are looking at social media to express their concerns, express or seek information, support from other social media users. Uh, Also, so like from patient journey standpoint, they do go through a multiple touch point today. It's not a linear journey anymore. As in marketing terms, people have to heard about funnel, and that actually assumes it's a linear journey. But it's becoming more and more of a sphere where the interactions are very, very complex, and people can have a moment of inspiration without really having a notion to really shop for something or look for healthcare. So so that makes it very complex, and it's very, very interactive, and it's important for the brands accordingly to be prepared to really kind of get a space in patients' mind as they think about strategies to really win trust of patients. And the reality is everybody is talking about digital transformation, especially like I said, in tier one cities and out. But very few are really reaping the benefits. We still see a lot of manual error due to oversight, lack of visibility. Um, we still have a majority of places actually maintaining paper-based history. As per regulation, you have to maintain history in hospitals, and people are still having paper-based history, which also means that a lot of data is sitting right there without really being used uh, for advancements in the healthcare research or anything of that sort. There's a lack of single view of patient, and that is one thing which even I think the government is trying to really solve with the ABHA and uh, some of these initiatives. But there's a lack of single view of patient. The best I've seen so far is hospitals really, bigger hospitals, typically having their own application where they're trying to ask patients to manually enter records, and but the repository is hospital's repository. We still see a lot of offline interactions where things are not really captured. And then there are broken operations. We see a lot of long booking times, waiting times. There's a lot of inefficiencies if you really kind of dive deeper into any operations. There's a lot of frustration also on the patient's part, as we see in typical hospitals, all because of the wait times or not really following a certain order. So yeah, seems like everybody has is agreeing that this is important, but to really reap the benefits, and there's a lack of systematic thinking as to how to go about it. Excuse me. The best we are seeing is, either you are big enough and have deeper pockets to really go out and create your own teams, which are through which you could actually, look at from a strategy standpoint and implement some of the things we're going to talk about, or people in with a fear of missing out, they go out and look for some other ready-made stuff, which are ready-made products out there, and try to kind of adopt it. So, and that's where I guess there's a disconnect where you end up solving one problem with one product, another problem with another product, and end of it, nothing seems to be talking to each other. There's a lack of integrated view. Okay, before I move to tech trends, I just wanted to check if there are any questions or anything which we need to address. Okay. Some of the healthcare trends, as we see, telemedicine again is becoming pretty common. Electronic medical record is also picking up quite a bit. Most of the bigger hospitals are now actually offering it. But we still see a lack of single view, like I mentioned about where you go to multiple hospitals, you have different set of records, and they're not really getting married. Uh, AI and ML is actually becoming so real for healthcare now. So there are various use cases from AI and ML, and we could potentially have another webinar just to talk about how AI and ML can be leveraged and how even smaller facilities can leverage that. But a lot of research can be really supported with AI and ML. Predictive analytics can help in with patient care, with patient alerting systems and all. A lot of decisions which doctors take for a complex situation can also be supported with AI and ML. And also the drug area, that's another big space from a healthcare standpoint. Okay, also personalized care, that's something which is also possible because of the data available, and using the data, if we really kind of leverage it the right way with using artificial intelligence and machine learning, we will be able to provide a lot more personalized care to the patients, and get more on the preventative side. And last but not the least, a lot of wearables are there now, mobile health, having information about your health on your mobile devices, as well as the wearables have actually fine-tuned the algorithm, and now the accuracy levels have gone tremendously high, to the extent that now even people are able to get their ECG report on their Apple Watch. I mean, it's evolving, they're learning, a lot of AI and ML has gone into it, but that's an area which is also kind of growing quite a bit. Okay. So just stepping back a little, so I believe with the data which we have shown, the kind of trends we are seeing, the kind of adoption we are seeing, it's kind of very clear that digital transformation in healthcare is really crucial. Not just because you want to do some fancy thing, because you could also lose your current state of business if you really don't adopt that. It also provides you the platform to unleash the potential of technology, which means that there are several use cases, as we call in the technology terms. There are several problems from a patient standpoint which you could solve if you really invest in digital transformation and really have a platform, a launch platform through which you can launch point solutions. Also, it provides you an opportunity to really rethink from the perspective of a patient as the center of the universe, not really thinking about your facility as such, but keeping patient in the center as the center, making the patient at the center of the universe enables you to also provide services and give services for which you could also charge patients and really kind of help the patient. So I guess we are establishing the fact that it is important, it's critical, but how do we really go about it, right? So people have different ways to really think about digital transformation, but how do we really go about digital transformation? So we will try to cover those areas in the remainder of the presentation. So in the three things which we'll try to cover, which we also mentioned as part of our webinar initially, was how to win patients' trust, like create transparency, understand patients' health concerns, provide explanation, be communicative with the patient, and show empathy and compassion. So how do we really go about that, right? The second piece will be, how do we really build intelligent systems that actually improves the experience? And we call it intelligent systems because we want the system to improve, continuously improve based on the data or the feedback we are collecting. and the data, it can be primarily data driven. And the last but not the least, how do we really optimize the operations and reduce cost to serve, as well as increase the turnaround time, especially when you have facilities where you are actually taking appointments, you have limited time in the day. So how do you really work towards addressing more patients and not and avoid longer queues, or even from a patient standpoint, how do we really make the patients wait less and as a simple use case? Okay, I'll pause for 30 seconds. Any questions so far?
Yeah, Pritesh, we have a couple of questions related to data privacy. Maybe I think something we are going to cover later.
Absolutely. We do have that as data privacy is actually very, very critical. And thanks for bringing it up. But we have a few slides on that later on. Okay. Any more questions so far?
None.
Okay. So we'll start off with our point of view, how and where we are, and we'll go from there. All right. So what the new age clinics and hospitals need, right? So patient-centered service design, and we'll cover service design in a little bit, but essentially uh, people, tools, process, what you really need, which has to be all patient-centered, which creates an everlasting impression on the patient. You have to leverage data. There's a lot of information we collect about the patient. We need to leverage that data to really improve the service you're providing to the patient. And then we covered a few other aspects of data, AI and ML earlier about using it for research, using it for um, other benefits you can pass on to the patient. The third thing is to really enable the doctors and admin to have information easily available to the doctors and admin so that right decisions, insights should be available so that decisions can be made. So more informed decisions can be made. So, again, for that also you need a process, you need a system, you need a mechanism through which that insight can be shared with the hospital, the admin or the doctors so that right decisions can be made, or certain processes, the tools can be tweaked to really do the right thing for the patient. Smooth operations, absolutely, that's really, really important. A chaotic environment nobody likes, and so will the patient walk away for that. And last but not the least, winning patients' trust is also key, especially when we have situations where there are multiple hospitals and multiple facilities available. The general notion is that going to a bigger hospital or any hospital would mean that the people will have to spend a lot of money with them because there is lack of transparency. What happens there, nobody knows. So in general, there's an area which most of the facilities we feel should really work on, and then as we look into the new age clinics and hospitals. All right. How do we go about winning trust?
समझ में नहीं आ रहा है मतलब ठीक है those are two scale models and
So I think one of the greatest tools which one could use in a healthcare industry for winning trust would be digital marketing and communication in tandem. So digital marketing in healthcare is again, a process of promoting the services through different digital channels, way of communicating to the patients about your brand, what you stand for, and then essentially uh, validating, provide validation to the patients who are searching online to really kind of provide the right information, what they're looking for, provide the right content people are looking for, and making it easy for the patients to really interact with your facility and book an appointment, get get any suggestions. So that's where the whole idea about digital marketing is there, and that's where I think most that's a big tool which most of the facilities can leverage to build upon trust with the patients. We see digital marketing as like broadly four pillars, and if you have already kind of been approached by several marketing agencies, we might be very familiar with it, but I'll just spell it out. The first is search engine optimization, which kind of enables you to appear higher on Google searches. Like I'd mentioned earlier, about 80% of the people are searching for facilities today, especially in the bigger cities. And then they're trying to kind of find the facility they want to go after. So SEO is a big piece of how you really kind of help out or how you can help your facility get higher up on Google searches. Second piece is social media marketing, which is around creating or being available on social media where your patients are hanging out, right? So providing information, providing knowledge, sharing knowledge about different areas. That actually goes a long way in creating trust. If a certain brand does more than just cure the patient, things like different kinds of content, which could be prevention. How do you really go about preventing something before something is happening? The social media again is pretty key, and it will become more and more important in the coming years, especially as you saw some of the stats earlier that people in the age group of 18 to 24 are more likely to discuss about health issues, seek for information on social media. So it's important that you're prepared for social media and you're actually working towards that. Also acts as a validation area of validation. Um, Third, campaign management, which is where you are really kind of working towards building connection with the patient. It's not like one and all when somebody comes on the website and walks away. But if you have information on the patient, if you try to uh, show empathy, provide solutions, provide solve or answer some of their questions. Campaign management is another tool through which you could actually do that, whether you're running email campaigns or WhatsApp campaigns, SMS campaigns, and last but not the least, paying like working on paid ads in different ways and form, where you're sponsoring events, or it could also be putting ads in Google or Facebook, where you really want to highlight some of the specific content which could be beneficial to the patient. So these are the four pillars from a digital marketing standpoint, which you can leverage. And what it really kind of means overall is, you can have targeted messaging, you can have very personalized connection with the patients because you have the data, you know the kind of messages you want to send based on the data. You could actually have a very personalized engagement with the patient. You can be very interactive, right? You could actually ask people for the feedback. You can have polls. You could really make it really uh, like a brand which is totally invested in somebody's health. So you can come across like that. So through digital marketing, that's really possible. Um, Also, with digital, what really happens is you're able to scale quite a bit compared to the traditional ways of marketing, and that's where you can actually get define your key performance indicators as to what you want to go after, and then everything is measurable with digital. And when it's measurable, you could see track the effectiveness of whatever tactics you're using, and then accordingly go back and tweak the tactics if you need to. And again, it's quite cost effective just because there's a big scale here. The kind of reach you can get to digital is ginormous. And you could also target multiple channels at the same time. So that's another good thing from a digital marketing standpoint. I'm pretty sure a lot of you might have already heard about these terms and terminologies from various vendors or various digital agencies. But I did want to touch upon digital marketing because that's important from a brand awareness standpoint. That's important in terms of communicating with your patients. That's important in terms of really winning trust of your patient. Okay, the next area which we wanted to cover was building intelligent systems. And here, as you think about, let's say you have a facility and you think about, okay, I want to start another facility here. I'll have 10 doctors, I'll have hospital beds. Then immediately you have a lot of choices to really see how you go about it. Either you actually have deeper pockets and you can actually build something from scratch. So you start hiring a technology team or which actually understands this and start building something from scratch. Or you can actually, look at products out there, right? Commercial off the shelf, something like, it sounds like, yeah, you know what, it's tried and tested. Why don't we go and buy some product and use it? Or this guy is selling appointment booking system. Why don't we buy that? So that's the second choice which you always have. Third is, somebody might say, oh, there are a lot of open source software available. Why don't you use one of these and you customize it and use one there? And the fourth one is, okay, why don't I hire someone to really kind of build something out for us? So again, all these four choices are great, depending on where you are, right? These are all great choices, but it also depends on where you are. But again, with each comes certain limitations. And which I've called out, like building from scratch, you need more money. Using commercial off-the-shelf products actually has a lot more limitations than the others, I would say, and mainly because it usually solves the problem as of today, but not in the future. So which means that going forward, you're always going to be behind everybody else. So because one size does not fit all, these are designed for multiple places. Your process, your systems could be very different than the hospital next door. So commercial off-the-shelf products typically will fall out on the usability and the usage. Open source software, again, that's something which is there, but you still need a technology team to really, and expertise to really support it and work on it. And outsourcing development, which also means that it may be cost effective, but it will require a lot more collaboration and communicating with the team that actually supports it. One good thing that has happened in the recent past is there are a lot of low-code, no-code software development platforms available, which enables people to really design as per the need at a very lower cost, because the development or the coding that is required to build the software has been totally minimized. A lot of workflow management systems are available. So essentially, it gives you the platform to really speed up the development, and then you can create the way you want. You can control the user experience. You could actually design as per what your patient experience needs to be. So that's where I believe these choices are always there, but you have to make those careful choices as you build these out. Again, uh, not to really kind of downplay cost product, which is a commercial off-the-shelf product. Uh, it has several limitations. I still wanted to call that out, right? So one size does not fit all, right? Limited customization options. Changes will be slow. Integration challenges are there, where you can have a different billing system, different invoicing system, unless you buy all the systems from the same guy. And then you're also locked in with the vendor, which is providing that. Upgrades and maintenance will always be there. You would be on one version of the software, and for moving to the next version, they will ask you for more money. So there are a lot of challenges with that. Now, if we were to really kind of go about it, right, what our recommendation is to really kind of go with a lean kind of a concept where you do the research or you work with a company, do the research, come up with a proof of concept to see what is it that I'm developing, right? Test it out with the patients, test it out with the users of the system, whether it's internal users in your facility or the patient, and then start building on it. Then you outline the features you want, you plan for these features, make it very agile or fast in the sense you should be able to develop these features at a fast pace, show it to the actual users, whether it's patients or doctors or using it or admins or facility in charge to see this actually makes sense. This is actually going to work in that particular facility with the process being followed. And then essentially you build, you collect data, see the usability, and use that as a feedback loop to go and say, hey, because of this, whatever we are noticing, we need to tweak this aspects. So that way you are able to create a very intelligent system, and you can also integrate some of the latest technologies, the advancements we are seeing. Where we create something like this. Okay. Any questions so far?
We have a question related to digital marketing.
Okay, we can cover that. If you just let me know what the question is.
Yeah. So how can healthcare organizations effectively use digital marketing to reach and engage with their target audience while maintaining compliance with industry regulations?
Okay, I will touch it at a little high level because that will require a lot more deeper dive into the digital marketing area. I would also recommend that if you want to set up another call with us, feel free to do that. But going back to digital marketing, the idea here is not to really go out with big banners and say we are the best, and despite what your services are, and uh, basically claim that you're the best and be in front of the patient. The idea is to really create space in the patient's mind that you are good at something, and the way to do that is to use the right content. The way you actually devise the content will be based on who you're targeting, what kind of services you're targeting. So without really kind of violating any regulations, you could still do that. A simple example could be if you start really putting in content which is more knowledge sharing about certain practice. Let's say you're a great heart surgeon and you want to really put in content which relates to how do you really avoid stroke, right? Things to do to really avoid stroke, and whether it's food habits, whether it's exercises. So if you really start creating content from that, and that's just an example, you are really kind of trying to show your concern and trying to be on the preventative side, which also builds the trust in the brand. So that's one way to go about it. In terms of the content which you have on the site and the content which you create on the site, it's also important to be regulatory compliant. Plus, also Google has its own compliance needs for something like this. So you have to, you have a double check it from that perspective as well. If you are spending if you're spending money on SEO, for example. So these are some of the ways you could still be compliant and still address some of, or still achieve your objective about creating a brand image or a brand awareness with your potential patients. I hope it answers your question. If not, I'll be happy to chat more. Just set up some time and the team will send your availability and the team will book an appointment. Okay, last but not the least, optimize operations. Now, a lot of things which we do as we try to create systems, could also lead to optimizing operations. But I would like to introduce a term here, service design. And this is something which other industries have really warmed up to quite a bit now, because they saw why it is really important. Because traditionally, what people have been doing was, you want to really kind of build a system. So you just think about the system, and you go about building it out. But service design covers like three or four different aspects. It covers the people aspect, infrastructure, communication, any material component, technology, right? So it covers everything that needs to be orchestrated to really provide the service of what a patient would need. And this is again going back to, and there's some principles here, right, around design thinking and all that comes into play. But maybe that's another webinar topic. But the whole idea here is that whatever services you're offering, it should be based on what a patient is needing. And it's user friendly and it's competitive. You are ahead of the curve, so that you are able to provide services at a level which are better than the rest in the market, and you are also relevant to the customers. So if we go into any service design engagement with any company or like any digital agency, you will realize how the entire process can be broken down into a lot simpler way. You can realize that how the patient interaction can be easily broken down, and then it really makes sense for you to start addressing the areas where we have gaps, the areas which can actually be improved, areas which can be automated. And that will help you in bringing in the efficiency and keeping the cost low of service. I realize we have about 10 more minutes or so I'll try to rush through a few of these slides, but again, at least give 5 minutes for Q&A towards the end. Threats to digital transformation. Again, we talked about data earlier, right? Data security is one of the biggest challenge. With a lot of compliance and in place, it's important to really ensure that the patient data is secured. The hands is exchanging is also secured. It's encrypted. It's masked. If you're sharing information at the metadata level. So that's a big concern, and that's been a big threat from digital transformation standpoint. And again, a lot of companies have been able to address it. The cost becomes a factor in most of the cases, where how you really go about it. And then data processing is another piece, which is also a big challenge from a transformation standpoint. Like you can build different systems which are, we can build systems to really solve the problem, but the data starts sitting in its own silos where the data for one system, and there's a less interaction between two systems. A good case here could be, even if you're not talking about multiple systems in the same organization, let's say somebody is going to Apollo and somebody is going to Vedanta, right? So the data is sitting in two different systems and the interoperability is not there. So there's lack of single view. Doctors typically will capture what the patient is telling them, that this is what medications they're on. There's no good way to really kind of look into that. So there's a data processing is another issue. Talent, of course, because data, like smaller facilities especially, will not be able to hire cybersecurity experts and data experts and people who could actually help them. So hiring the right talent for that is also a big one. And in general, if you have a process going on and that process could have been there for long, then there's also a resistance to change it. This is working. Why are we really changing it, right? That's an usual norm. Only to realize that over a period of time, you start seeing that something else is catching up, and your facility in the neighborhood directly has picked up, has a better way to really address patients' concern and their health. And last but not the least, the budget constraint, because typically people will say, hey, I want to go about it, but I think it's going to be very, very expensive. So, and that's not really the reality. It's a matter of really investing some time and doing some research, or also kind of having a thought leader with you who could actually help you in understanding where you are in the journey, right? So everybody has a starting point and what it takes to really get to where you want to get to. And the process of getting there, it need not be a big jump. It will require a big investment. You could go with a crawl, walk, and run kind of a mode where you are, if you are just starting, okay, let's learn to crawl in the space first before we start getting to next. So that's where I would say go in phases as you go about a constraint. Um, I would also like to call out a few things which we have noticed, especially in the West, where a lot of digitization of records and information and everything else started pretty early. And what people realized was because they were all creating a system, thinking from a system standpoint, it ended up really adding a lot of time for the doctors to even enter the information in the system. Because earlier, from being a paper-based usage, people had to really go into a system and key in the data. And that has become like, like the single most challenging aspect as people talk about digitization of the health record and the information, the patient interaction. So if we were to design it differently if you were to think of from a service standpoint, and we were to design from keeping the doctor in mind for such systems, it would have actually done a lot more for the patients compared to what it did. Because now you see a doctor for 5 minutes and they log in 15 minutes and putting keying in the information in the system. So these are some of the challenges and threats which I noticed on the transformation. Uh, in the current world, like if you are not doing anything right now, where you have a paper-based system, some of these are like, very like a table stakes is what I say, right? These are like features which everybody should have. Like usually have a system where you can register all your doctors, have a system where you can register all your patients, capture information, book an appointment easily, manage the patient in terms of, intake form, uh, all the records can be uploaded. And then last but not the least, as the owner of that space, you should actually have good reporting, which shows, how everything is doing, and what is how the turnaround time is, what the patient satisfaction scores are. So these are the things which we actually recommend that, if you're starting new and you want to really kind of get onto this, so this could be a good starting point to start looking at your facility from these aspects, how to enable these aspects. Okay, how can Pravaah Consulting help you here, right? So we would love to be the steward in your digital transformation journey. We will definitely share our expertise as well as experience of working across multiple industries as well as other healthcare providers. Uh, we can build scalable solutions, compliant, data security can be no longer be your headache, it can be our headache. We take away the headache from you. Keep the cost low with some of the low code, no code software development platforms, right? And then as you are evolving, as you are scaling, we can look at different architecture, but that's something which we can work on. Also, faster time to market. You don't really have to wait for months and months to really kind of enable one particular functionality. You could do that in weeks if you work with us. And then the features could be an ever expanding list, and we can keep adding features as we really kind of want to really enable better patient interactions and management. So these are some of the things which we do, which we can work with you on. Digital marketing is another area which we are very, very good at. We have seen great results, especially when we go about localized marketing in terms of number of patients, reducing the turnaround time, patient satisfaction scores, and all. Okay, think we talk about some of the key benefits. Like I guess I will just park some time for Q&A if there is, but these are some of the key benefits you get if you kind of work with us. Okay, let's go to a quick recap, right? So we talked about digital transformation. It's real, it's there. We need to really think about how do we really enable that for mid-size healthcare providers. Some of the flows which are table stakes, those are some of the things we can get started with. Patients expectations are different now. Everybody expects a lot of information available to them about their health symptoms. People are expecting alerts about their health risk. So those are some of the things which are out there, and something which you could actually build out for your own facility or leverage what's available. Okay. It's almost about time. Are there questions, Vinny?
Again, a couple of questions.
Sure.
So one is very, how to effectively evaluate and select the right solutions or digital solutions for one specific needs.
Yeah, it's a good question, and typically what we do is we can actually provide some sort of a chart which will help you decide, what kind of solution would work. It's almost like, you answer a few questions and, you'll see, this will work or not work. Um, just to give you, make it contextual here. If you have a facility which has a very evolved process already in place, and at that point in time, you want to go and buy a commercial off the shelf product, it will mean like overhauling a lot of things within your hospital or your facility, because you will have to go back and start designing your whole operations around the product itself. But uh, typically in such cases, I would advise that you look at the process, of course, because the process optimization is key to it. But the product or the system which you build should be working for you, not the other way around. So that's one example. Let's say if you're starting like totally new, and if you have an idea about what services you are actually going to go after, then you go for a solution which is scalable, in the sense scalable not just from the size standpoint, but from a feature standpoint. The faster such solutions can actually add features to it as as you kind of increase, as you demand more. For example, these days AI and ML, they're everywhere. So can that new system support integration with some AI engine, right? Can it actually give the doctors benefit of really not really thinking through all the possible combinations of issues that could be happening, but make it easily available for the doctors, right? If something symptom is written. So if you want to get to that level of maturity, if that's what your vision is, then you would want to go with a system which actually gives you that flexibility. If you feel that, okay, my facility for the next 10 years is not going to grow as much, and I primarily need just a booking system, or I primarily need a one appointment management system, and this data can sit there, I'm not going to interact. Then in such cases, there are a lot of point solutions out there in the market, which can be also evaluated. We also help out in evaluation. In general, that's free of cost. If you need to really say, hey, these are the few options, so I'm trying to select, can you help me evaluate? So that's another area which you can actually look at. Any other question?
I think you pretty much covered it, but there's one more question wherein someone wants to know what are the most promising areas of digital innovation in health. I think you already touched upon by saying.
Yeah, there are some, when you say promising areas, I guess one thing is just from a healthcare standpoint, robotics is huge right now, and it's becoming more and more real, right, from a doctor standpoint. So there are several big seminars that's happening just from a robotic standpoint. But when you talk about as a service provider, and when you talk about experience and all, there's a huge investment happening in the data space, where AI and ML engines are actually going to be leveraged quite a bit in terms of solving some of the use cases, even from digitizing records. For example, you have all these paper-based systems. How do you really convert that into database, and how do you drive insights from the data that's there in those paper-based systems. So those are the things which will help, which are kind of trending quite a bit these days. Data related, robotics, I would say.
I think Richa has a question.
Yeah, Richa, if
Hi,
you can.
Pritesh. Good morning. First of all, thank you for letting us know about your business plan. It was wonderful. My question is very specific, and it is for Prava, actually, not for the digital marketing. I just want to know what is the value proposition of Prava, and specific product differentiation to have an edge over existing software which is already there in the market.
It's a very good question, Richard. Thanks a lot for asking. And I know we
Yeah.
are over time, but I'm going to also record this. So
Yeah.
with Pravaah Consulting, what you'll notice is it's not a software development company. What we are providing is essentially a very user-centric approach to solving problems. And again, what we do is we blend design, technology, and marketing to really do that kind of a work. It's not just about thinking technology and implementing something. It's not just about thinking marketing and implementing something. It's not just about design and just be fancy and creative as to what we can do. But we are blending it together. We are trying to bring these three things together to make it real. To say this design will work because the data suggests that. This is the kind of system you want to build because the usability study suggests that, right? Or this is this kind of software you want to build because it's scalable. You can actually add more features to it. So that's one thing which you get to work with us. Plus, what we are also realizing is with Pravaah Consulting that a lot of experience we have had with other industries which are further along the way in their digital transformation. We could actually bring the learnings from those industries to healthcare as well. So that's another area how we have to actually distinguish ourselves compared to software developers or companies who could be doing this work. And the third piece is, there are bigger companies actually which offers a similar proposition like we do. For example, Deloitte Digital or Accenture Interactive. All these guys are great, but then at a level where smaller facilities are operating, it's very difficult for the smaller facilities to get that kind of a guidance and support, which these guys would actually give to a bigger client or a bigger Fortune 50 clients. With Pravaah Consulting, we do get that strategy, just because of our own experience of working with some of the big brands and clients. So these are the three things how I would actually distinguish ourselves.
Okay, thank you. Cool. And I'll connect.
Okay. All right. Thank you, everyone.
Thank you, Pritesh.
Yeah. Bye.
Thank you.